My name is Mark Siomo. I'm the Chairman of Ways and Means and the District 9 City Councilor. Today is Thursday, May 23rd, and we are here with our good friends from Emergency Medical EMS Services.
Yeah.
Happy EMS Week first. I'd like to remind folks this is a public hearing being broadcast and recorded on Comcast Channel 8, RCN 82, Verizon 1964, and streamed at boston.gov/city-council-TV. I'd ask everyone in the chamber to silence their electronic devices. There will be public testimony taken at various stages throughout the hearing. There is a sign-in sheet to my left by the door. I ask that you sign in, state your name, affiliation, residence, or check the box yes if you wish to testify. There are numerous ways to testify. You can attend a public hearing such as this one and sign up, as I just stated. You can email the committee at ccc.wm@boston.gov. You can mail the committee at Committee on Ways and Means, Boston City Council, 5th floor, Boston City Hall, Boston, Mass. 02201. Or you can come to a hearing dedicated to public testimony on Tuesday, June 4th from 2 p.m. to 6 p.m., and we will stay as long as necessary to make sure that everyone is heard on the budget. As I said earlier, we are here with Boston EMS as it pertains to the FY20 budget review of dockets 0622 through 0625. Orders for the FY20 operating budget, including annual appropriations for departmental operations, annual appropriation for the school department, appropriation for other post-employment benefits, and appropriation for certain transportation and public realm improvements, as well as dockets 0626 through 0628. Capital budget appropriations, including loan orders and lease purchase agreements. I am joined by my friend from Dorchester, City Councilor at Large, Anissa Sabi George. I have letters from colleagues who are unable to attend, whose letters I will read into the record. Dear Councilor Siomo, I regret that I will not be in attendance in today's hearing on dockets 0622 through 0628, FY20 EMS budget due to a family commitment. I want to say for the record that it has been an honor to work with Boston EMS over the course of my tenure on the Boston City Council. You are the finest EMS service in the country, and I am proud to have worked with you. Signed, City Councilor, District 5, Tim McCarthy. Dear Chair Siomo, I regret that I am unable to attend the EMS budgetary hearing due to work-related travel. I would like to thank EMS for their critical work and specifically note that East Boston is thrilled to have a second ambulance available to the area. Thank you. Please read this into the record. Regards, Lydia Edwards, Boston City Councilor, District 1. And finally, dear Mr. Chair, due to the work-related travel, I regret that I am unable to attend today's hearing of the Committee on Ways and Means on dockets 0622 through 0628, the FY20 budget for Boston's EMS department. My staff will be in attendance, and I look forward to reviewing the records of this hearing. Sincerely, Kim Janey, Boston City Councilor, District 7. And I will just, before I turn it over, say similar that we are very proud of the work that you and all the men and women that are out in the field today or at home resting up for their shift, that we owe them a debt of gratitude for the fine work that they do, great reflection on all of our public safety first responders in the city of Boston, and for your leadership, Jim, has been exemplary, and it's been an honor for me to work with you as well. So thanks for being here today, and it's all yours.
Okay. Thank you. Good morning, Mr. Chair and Councilor Sabi George. We're happy to be here today. We're happy to entertain any questions you have related to our operations, to our budget, our plans, initiatives, our performance. And with me today is Laura Siegel. Laura's our Chief of Staff at Boston EMS. And we also some of the members of command staff and our budget office, as well as public health, who are available should we need to reach out. But I think we should be well in hand there today. Thanks. And so for opening statement, all I really have is what was on the slide deck there, which I think you have hard copies now. Okay, because we some technical issues.
Yeah.
So I'll just go through it quickly. Oh, and first of all, and also I do much appreciate the letters from the counselors who couldn't be here today. I don't remember ever hearing that before when somebody didn't make us. That was very nice sentiment. It's well accepted by us. Councilor McCarthy was particularly good over the years. I don't think he ever missed a graduation or award ceremony, anything like that. He did. He wasn't exaggerating how much pride he took in the service, and it was well felt. And Councilor Edwards and Janie have been very good to work with as well too. And she's been working. Councilor Edwards really helping us a lot with Charlestown, as well as East Boston coverage issues. So we appreciate that. And just one more thank you on that. Yesterday, I missed the resolution that you offered on commending EMS week, but that's because we were at the East Boston event and ran a little bit over, and some obligations there kept me from coming back lights and
You had a
siren for
worthy
it.
stand-in.
Yeah. No, but thank you very much, and that was well received as well. And so, I'll just start off as we get into just sort of the end of National EMS Week, and you all marked it yesterday. Thank you. And City Hall last night was lit up in orange and blue. Looked very nice, and we appreciate that as well. We have a couple of more events left. Principally tomorrow, we're having a blood drive that we're running up at our headquarters, up where our training division is tomorrow. So that'll be probably the last official event that we have scheduled for EMS Week. So I'll give you just a quick overview that was on slide 1 about Boston EMS, and that we're a bureau of the Boston Public Health Commission. We are a 2-tiered system. We offer basic life support and advanced life support. We in 2018, our volume numbers were that our call volume was 126,419 clinical incidents, and that required 154,417 ambulance responses, because sometimes you just have to send more than one unit to a call. That resulted in 85,697 transports. And so on a typical day, on an average day, that could be 350 calls, clinical incidents in a day, and 240 transports. So in a 24-hour period, we stay busy. Where we currently have 421 full-time budgeted positions, and 395 of those are uniform. Some of those positions right now are in our training academy, a current training class, which is getting ready to, they're just wrapping up their 3 months in the classroom and scenarios and driver training and everything else that we throw at them. And they're going to begin their field internship starting this weekend. They'll be doing the first, they call it immersion round. They'll be riding third before they go into the training trucks, where they'll be basically operating as a regular ambulance with two trainees with a training officer, and hands-on for the next 3 months, completing their training. And then when they successfully pass that, we get promoted from recruit to EMT, and we'll get notice out for that ceremony as well. In field operations, Boston EMS, we operate 21 BLS units, 5 ALS units from 16 stations citywide during peak hours. So it's principally the day and evening shift. At our lowest ebb, we come down to 14 ambulances covering the city between 2 a.m. and 6 a.m. We try to match our resources to our call volume as best we can. Several crews shift change at a station, then repose to a more strategic location, which is determined by call volume. So there's more ambulances than there are stations. So some places we do have to double up and then go out and do coverage. And on that map on there is a map which denotes ambulance stations, as well as where Boston EMS ambulances are posted. Okay, and dispatch operations. Our 911 calls are handled by uniformed members of Boston EMS. They're all EMTs. They were all field certified. They all went through the exact same training to come in to be competent in the field. Some of them work both sides, as you will. They work in the ambulance. Some then go in, they take this additional training program up in dispatch ops where they go through much more training, where they get certified to do emergency medical dispatch, work with the state's E911 system, and now text to 911 and every other thing that gets involved in call entry, call screening, prioritizing calls for dispatch, dispatching, and then at CMED, where we coordinate field units with hospitals, notifications to hospitals, or coordinate disaster coverage or the distribution of patients at large events, such as at the bombing back in 2013. A lot of success for our patients system-wide was due to the fact that patients were very evenly distributed, particularly the critical patients, where our CMED utilizing our system there, we were able to distribute, to get the right patient to the right hospital at the right time. That was particularly life-saving that day and really every day. We have a research, training, and quality improvement division. It has a full-time accredited training academy. It provides continuing education for all uniformed personnel. Tonight we start another 24-hour training cycle where we'll be training on all three shifts. It's a rigorous 6-month training program for new EMTs and a 3-month internship for paramedics who get promoted here as well. We have simulation labs up there as well as other equipments. And most importantly, for recruitment purposes, we have an affordable basic EMT course, which is open to the public, which we've recently made it, we have priority status to Boston residents to take that class. And if there's still seats available, we would open it up to non-Boston residents. But right now, we fill it up quickly with Boston residents who are hoping to become certified as EMTs so they could take our entrance exam. On the next slide, we have our special operations and emergency preparedness division. Last year, they supported 849 special events across the city. That keeps growing every year. We have a couple of big ones this weekend. One out your neck of the woods, Council of Boston Calling, and out at Harvard Stadium. The last few years, that's a 3-day event, and we've taken all our special events. The premise of our planning going in is that we want to cover the event, cover the spectators, the talent, the concert goers, or whatever the event is, take care of the public safety officials who are there as well, because sometimes it's in hot weather in the summer, or what have you, or cold weather when you're doing a sports parade when the Patriots win again. But our goal is to make sure that we don't ever either strip the neighborhoods for coverage or have them have to wait for ambulance response because we're tied up taking care of maybe multiple minor injuries or getting multiple responses at an event. So that's our plan again this weekend for that. We will have medical stations on site there. We're going to have our EMS physicians there as well, so we can maybe, if we have to, even treat and release some people, which normally only physicians can direct that because we're obligated to transport unless somebody refuses. That'll make us a little bit more efficient. And whenever we meet, and even in this case with the promoters, we've insisted they have to hire a certain amount of coverage because even with that last year, we once or twice had to bring in either ambulance 14 or ambulance 9 to help us out with the transport, and our goal really is not to do that. But that's just an example I'm highlighting because it starts tomorrow. Right. Just to let you know. We also have the Run to Remember this weekend, along with some other events, and now we're going to host a Stanley Cup party on the plaza here Monday night. So, so our special operations and events will be busy. We do extensive planning and coordination efforts with the city and regional partners around things like, obviously, like the marathon or tall ships or what have you. But we do a lot of training and exercises to prepare our personnel for all hazards. Whether it's, a few years ago, we geared up for the potential of taking care of patients with Ebola, which, there were preparations around the country when there was some of the cases cropped up in Texas. And we'll do special training for that. We'll do special training around other threats, whether it's radiological emergencies or nerve agent, anything that you can consider that we should plan for in advance, we do there. We've been doing a lot of training now. We've been rolling out more training with the Boston Police for incidents where to coordinate efforts between police, fire, and EMS, should there be some sort of mass shooting, should there be some sort of, vehicles into crowds, things we see around the world. We've already have had bombings here, but we still keep practicing that because you have to consider that, even though hopefully it's never going to happen again. We have a Community Initiatives Bureau. They do public safety, life-saving skills education. They're present at a lot of community meetings and events. We regularly schedule car seat checks and installations out at our Mattapan facility. A lot of residents take advantage of that. We get a lot of great praise and thank you for that. We also have a program where if people have difficulty affording car seats, we can get them for low cost or even no cost in some cases for them, to assist them to make sure that we can really prevent injuries. We offer CPR training. We do a lot of training with compression-only CPR. One of the things we found out years ago, even though it's great that even in a building like this we have AEDs on almost every floor, one of the biggest things we found in our cardiac arrest survival database was that if you receive CPR, even if it was just compression only, no rescue breathing, that greatly enhanced the chances that you would live to be resuscitated and discharged, from a hospital. So that's been one of our goals, to keep pushing that training out to as many places as we can. And we do a lot of programs with seniors, the File of Life program, working with advanced directives and medical orders for life-sustaining treatment, to make sure that our personnel understand, because it's very stressful sometimes for families to deal with, and we want to make sure that they know what to expect from EMS when they arrive. We at a scene, if it's they have some sort of advanced care directive or healthcare proxy in event, but we also make sure that our folks are well versed in that, so that we can handle those situations. And they also work with the Mayor's Office of Emergency Management on preparedness issues, as well as public health preparedness, to make sure people are ready to sustain themselves during emergencies. On the next slide, just some of the support services. It's the majority of our department is uniform staff, EMTs and paramedics working in the field or up in dispatch, but we are fortunate that we do have a small but very competent fleet division, who they maintain and service our ambulances and our supervisory and other support vehicles. They're all licensed in-house mechanics, ASE certified. They're ambulance manufacturer certified, so that helps us that covers a lot of, that helps us with some of the warranty stuff as well too, before we have to send stuff out. Materials management is where they stock all of our medical supplies, equipment, drugs, do the ordering, make sure the expiration dates are in check before they get sent out to the ambulances. We've gained some efficiency there in the last year or two now, where we try, you have to keep a certain amount of stock on hand to make sure that you always have at least a couple of weeks extra in cases disruptions in deliveries or services or shortages come up. But everything you have in medical services is an expiration date on it, so you don't want things rotting on the shelf, for lack of a better term. So trying to manage what the appropriate power levels would be, what are the triggers for ordering it, inventorying it. Some of the other things we're trying to do to well, a couple of years ago, we wanted to save money on, we've all seen the stories about the exorbitant cost of EpiPens. Well, hey, our paramedics can do IM injections, so they came up with these check and inject kits where we could essentially do the same thing, but not having to use the auto pen, where you're drawing it up because people are qualified, and now the state is actually, embraced that and going to make that available for our EMTs as well, too. So again, that's a medication that's fairly expensive, even if you never have to use it and it outdates, or the delivery system, the auto injector. So again, anytime we can gain efficiencies there, and by that I mean saving money, that's important, because that's our non-personnel costs. We always try to manage those well as well. Technology services, they maintain and manage the department's technical solutions, including voice data systems and our computer network needs. We've become, just like everybody in here, more and more dependent on electronic devices. The ambulances have one computer that works the mobile workstation, getting the call information from dispatch from 911, the routing, the mapping, everything just keeps getting more sophisticated. And they also, the crews use an electronic chart now for the last 10 more years now to record our patient care records and transmit it to the hospital. And that's a tablet-based thing. And so to make sure those are working efficiently, that they're secure, that they have to be very secure because of the confidential information that's on them. So they maintain that, as well as our office technology needs. We have a facilities division, a division of one, John Cushing, but he manages all of our department facilities, and working along with the facilities unit up at the Public Health Commission as well. But he also has to integrate a lot, because in some places we rent, in some places we share space, and with either police, public works. So it's having good partnership with all these sites that we host with, and being able to work, like, what's our responsibility versus the owner versus the landlord, whatever it's like. So it's busy keeping up with all that, but we're grateful that we have a facilities division. And our administration and finance, the commission, of course, has administration and finance and a budget director, but we have a lot of day-to-day needs, so we work here to make sure that we're in conformance with that, and obviously with all the city standards as well. So we're fortunate to have our own administration and finance small division that works on our budgetary functions and procurement things to make sure that we're following the commission guidelines and integrating with them. And so the next slide. And one of the things too is, because we are a Bureau of Public Health, and we in our just a quick slide that's up there, and you saw this during the budget presentation last week with Public Health. We want to make sure that we're in alignment with Public Health strategic plan with their 4 priority areas: racial justice and health equity, workforce development, informatics and data, and collaborative partnerships. And that's something that we seamlessly are able to fall into, because that is very much what we do every day, and certainly always share those priorities as I think most city departments do as well too. So it really makes it easy to have those cross-cutting efforts. Next slide, on our FY19 accomplishments. Well, one was we did welcome the workforce development, the City Academy, that opportunity that came along. I know we talked about it last year, and it is already started to pay dividends. The first class of people who these were city residents that were pre-screened, pre-selected by the City Academy, the Mayor's Office of Workforce Development, for admission to our EMT training class. And they were giving basically a scholarship for it, where they would be have their fees and their books covered. They got some additional training and a few different things to help prepare them to make them good, successful candidates, to identify them. And we'll have 8 of those who got certified this past winter, who will be joining us in our recruit class. They just gained admission to our recruit class, which starts June 24th. Okay, this month. So we're getting it in this fiscal year by that much. But anyway, there'll be a class of 28 that's coming on, because that will include the 4 additional FTEs that you have approved, or that are, are included in this year, as well as for the vacancies that we have, because we did get the 20 additional FTEs last year. And even though we graduated to recruit classes, we're still trying to catch up with some retirements and some other folks who have decided to move on to other opportunities. So we had a little bit of
Like a lag.
Attrition, thank you. I was going to say transition. I was stumbling for the word. Thank you. And but we're we're aggressively trying to make up for that and keep the classes filled.
How many positions are open, Jim?
What's that?
How many positions are unfilled right now? And you
Right
have,
now,
395 uniform personnel, right?
Okay, we had, I believe, going in, we posted this, I think we had about 18 or 19 vacant positions. So when, from our uniform ranks, and then anticipating that, we usually, public health always allows us to put a couple more on in that class, knowing that, historically some people drop out, or they decide, hey, maybe this isn't really right for me. But, we always want to get 100% through. Right. But we also know that by the time we finish a 6-month training program, we're going to have other people move on. We used to average about 13 per year. Some years a little bit more, some years a little bit less. But, I'm sorry, usually never less. Some years a little bit more, but on average before it was about 13 per year that would be moving on. So right now with that class that's coming on now, the class is that's currently in the academy, they're counted in the budget slots. So the vacancies now those will be gone in a couple of weeks when this class of 28 starts, because we'll be technically over for a little bit until the new budget kicks in on July 1. Improve employee retention. That was one of our goals, and a few different things we've been trying to do with that was, one, we've been meeting regularly with the Patrolmen's Association, the VPPA EMS division. We've re-energized one of the joint committees we have around career ladders and training. Again, trying to increase not just opportunities inside for advancement, but also job satisfaction. We have a lot of bright, eager people who work here who are busy performing their duties every day in the ambulances or up in dispatch, but they also have other interests to bring in other things to expand us or expand our skill set. Or, hey, have you guys thought about maybe we should do more training with this department, or with some other things that they see, or in other agencies, whatever. And so we've been open to those ideas and trying to develop our personnel at all ranks by doing that, taking advantage of. There's a lot of free courses that the feds offer down in Emmitsburg or in other places that we're trying to get more and more of our people in from various ranks to take advantage of that, which, one, gives you a little bit of a break from your daily grind, and it also it helps develop you and prepare you for potential advancement down the line. Speaking of that, we promote paramedics from within, but you have to have paramedic certification to be able to take our promotional exam for that. So a lot of people, they go out, they get their own training for that. And there's several institutions around, but we're trying to partner with more of them, look at other ways that we can improve that career path for promotion to paramedic. One of the recent things we did was we met with one of the paramedic training academies who I think they realized that it looks good for them when they have Boston EMS grads take their program. So a couple of them have now begun to offer discounts to personnel if there's a certain number of, well, one for sure has already started offering, and I think a couple of others are going to kind of copy on to that, want to be a part of it, where they'll give some discount in tuition based on volume if they get at least a certain number of our personnel sign up for a particular class, because quite frankly, it speaks well of their program if somebody who works here pursues them for their advanced education. And Bunker Hill Community College has also partnered with us because they realize that their course credits for people who have taken EMT training and for ALS training, where they'll actually give you credits towards their associate degree programs over there, should they want to pursue that. So again, we're trying to do as much as we can to help advance our personnel. One of the things, those extra, being able to hire and bring people in, those 20 extra positions you gave us, helps us with too, is to do promotions and assignments. Because for several years when we had, I wouldn't really say a hiring, well, we are basically a hiring freeze after 2013 when the budgets got tight, and for a while when, even back earlier, 10 years ago, when was the housing bubble burst, and they were canceling classes, police, fire, EMS, and we were all kind of holding off for a bit. It took a while to come back from that, and we're just now, thanks to you all, getting back to the levels that we were going to be approved for back in 2008 or 9. So what we did for a few years was we held off on promotions because we needed as many people in dispatch, in ambulances every day to try to keep the lights on, keep delivering services. So by getting the fresh blood coming in, the new recruits and EMTs, we have been able to start to catch up on our promotions the last couple of years, our supervisors, a training captain, deputies, where we were sort of shorthanded in all those ranks. So that's been very helpful for us. Also, last year, exploring clinical innovations. We talked about some of that, and with the epinephrine, to expand, be able to do it that way to the BLS, as well as CPAP and some other initiatives that the state's looking at now. On the next slide, I did mention the City Academy, and we, again, this is something that you all very much supported, and the mayor was very supportive of it. We had one cohort in that group from City Academy went on to get their commercial driver's license because the city identified that was one barrier to employment for the city. Like a lot of city departments do have the need for CDLs, parks, BTD, a few other ones who have large trucks, have it, Public Works, of course, and that you had to have that before you could even apply, sort of like you had to have EMT certification before you applied for us. And what they did was they were like, well, let's train some people, and they did that, and then another cohort in that first group there was people who wanted to pursue careers to be EMTs, which was honestly a little bit heavier lift. Nothing against the CDL program, but these people were dedicated. They took a 4 or 5 month EMT training class, as well as whatever they had to do to manage their personal lives. And a couple of them stayed on as interns for us while they were waiting to sit and take their exams. And they all agreed. And what the city did to try to really put them in the best possible position to pass the class and to eventually pass our entrance exam was that they gave them aptitude tests. They gave them some other out of the candidates that they screened. They did a bridge course to help get people back used to studying and taking tests if they'd been out of school for a few years. And the people who were offered them were actually, they did queries on them. They confirmed their residency and checking their driving history and license. And that was to me, because that's what you need to do to apply for us eventually. So they wanted to put that in their mindset right from day one. If you're serious about working at Boston EMS, then we're going to start building this in right from the beginning. And that's something that just taking an EMT class somewhere, we could never do that. We wouldn't expect people to do that. But, you know, the city really, they're investing in this, and so they wanted to be serious with their students as well. Advanced EMS and city services through analysis and EMS data. That was another thing that we wanted to do last year, and I get, what's on? The data reporting. I'll just give you a quick thing on that. We had, you know, Vision Zero is one of the things that we've been supporting for years. Boston has continued to support roadway safety measures by the use of our data to, not to identify hotspot, but we can get down to various levels, like whether there's a car involved or a truck involved or a bicycle versus bicyclist. Our people, for the most part, take very good care when they're documenting, and whether a helmet was used or whatever. So when they're evaluating, trying to make this data not just numbers, but what can you do to inform policy, to inform where traffic calming measures would come in, because there's a lot, your constituents come to you all the time looking for, like, we want one-ways, the stop signs, the bike lanes, what have you. How do you prioritize all those requests? So we tried to really, for the last several years, give them data they can use. And I'll just give you a quick one. So in calendar year 18, we had we documented 425 cyclist, crashes or incidents on Boston streets. And that's a 24% reduction from 2013, where the numbers were 570. So Boston is getting better at that. There's certainly no less bicyclists out there, so that's encouraging. We're not picking them up. Pedestrians, calendar year 18, we documented 680 incidents where we took care of a pedestrian. And that's a 24% reduction since 2016. And we make that data, publicly available. And so the bike community can, they're available to look at that, and we report it out to the state as well too. So that's good effort on work on everyone's part, streets, police, and everyone to help with those numbers, because our call volume goes up, so we don't mind trying to reduce incidents like that. I'm sorry, and we also work very closely with the Office of Recovery Services, Bureau of Recovery Services here at the Commission, to really try to help inform them with efforts as we all deal with this ongoing opioid crisis. And, we coordinate with the Boston Police Department and the BEST team trying to support their co-responder project to see if there's some other ways to. There's an increasing number of calls out there for people with, psychological emergencies, mental illness emergencies, where sometimes just going back and forth to the emergency room a couple of times a week or a month isn't necessarily the best answer. And some of these get a little bit complicated on scene, trying to sort them out. So the BPD do have clinicians in, I believe, 3 or 4 cruises in different districts now. And we're trying to work with them to see if they can either free up some of us but on calls, but also to complement us if we do have patients that we can maybe talk to them about, that they can help get services for. Our FY20 initiatives, and we asked for these, and these did come in the budget, was we wanted to expand our community assistance team to 7 days a week. It was launched back on October 30th, and as of April 30th, the numbers are on there. Counselors, we had Squad 80, they had over 3,500 total incidents that they responded to, and 77% of those the responses did not result in an ambulance transport. And over 1,000 times they were able to cancel an ambulance that was coming in, and over 1,000 times they were able to make referrals to recovery services or shelters. And so why is that important? When we, besides being good for the patients and good for them, sometimes people don't necessarily, even though they have an issue, they don't necessarily have to go to an emergency room. And another thing that was affecting that was a couple of years ago, the Department of Innovation and Technology. They did some analysis of our CAD data, our 911 call volume, same CAD the police and fire use, and they generated some heat maps of a couple of different areas where we would see frequent calls for unknown ambulances or priority one calls that we really don't get very good information on, so they're kind of hard to characterize. So because of that, an ambulance gets dispatched. It's a priority one call. Police and fire are also added to it. But in one area they noticed was like downtown here, Tremont Street, the Common, Downtown Crossing, even out here on Cambridge Street. There was a high percentage of those calls, 75% of them, wound up not resulting in an ambulance transport. It was somebody that was in need of some other services. Maybe it was somebody that was trying to get into a shelter, or somebody that was had some issues around drugs or alcohol, and maybe some street outreach or some other things was a little bit more appropriate. Or they frankly didn't want to go and they were refusing, but maybe they seemed a little bit unsteady, and we were trying to get them referred on to another services, whether it's any of the homeless outreach entities that are out there. That one tied up an ambulance trying to sort that out, that ambulance wouldn't be available, say, for another priority one or any other priority call. So and the second area where there was a high percentage of calls and a smaller density was, so in a small area, was the Mass Ave corridor up from pretty much just from Everett River Square down past Washington Street, that some of, come to call Recovery Road, where we have a high concentration of calls. And up there's a little bit more transports for these units when they go out, but there's a high incidence of repeat patients that we see fairly frequently. And again, if sometimes it's maybe we're serving them better if we get them to go into PATHs or A-Hope or the Engagement Center or somewhere else, where if they're stable and refusing treatment, where maybe that's more speaking to the problem that they need services for. And again, coordinating at the street level with the providers that are out there. The city's is putting a lot of efforts to address this. And but sometimes if you're in an ambulance and you pull up and now you hear they want to know, can you clear to go do another call if somebody get hit by a car 3 blocks away from there, and this person really doesn't need to go, you're kind of tied up. You can't clear out. The idea was to get a unit out there that could either do that call or come or relieve you so that you can get clear. And that has proven to be fairly successful, as you can see by the numbers. We were running it as a pilot program. We're staffing it on the day and evening shift, Monday through Friday. And our request was to add a few more FTEs so we could expand this to 7 days a week. And those, we'll be able to do that, once we get this other class on and up and the body's out there. A diversity officer was also one of the FTEs that we requested and is included in this budget, with the idea, we've all spoken to the different public safety agencies about, the importance and the efforts to improve our diversity, whether it's in developing people, such as getting people trained as EMTs, or then recruiting them, getting them through the academy, but also, promotions and trying to do better at all levels of the department. And, no different than police or fire, we take that, very seriously. And what we want to do was be able to dedicate someone's, I think we do a pretty good job at it right now. There's always been the will and the effort by members here at Boston EMS to do this, albeit maybe somewhat ad hoc. Some folks from training, some folks from field ops, and some of us to go to community things. But so now it's maybe by bringing this person on, one, we can work dedicate a little bit more time working with places like City Academy or various HR or schools or whatever to work with some of these partnerships to improve that. And, but also to help with some of the retention, professional development, and other things I mentioned earlier that come with growing the service. And then on the last slide is our FY20 initiatives, and one is to optimize our in advance our patient care services. By again, once we complete this other group of recruits on, we will be able to add an additional units on the busiest shifts on days and evenings. We'll also be able to make sure all of our promotions are filled there as well, which will be good. One, it's good for morale. It's good for the workload of the people who are in those positions now, who are maybe doing some of the double duty. One is we want to explore alternate billing and transport models. There are some potential ability. CMS recently announced some programs, basically like grants, where alternative delivery of care models where that don't necessarily result in transport, where you still could bill Medicare for that, which would help, because when we go to a call now, if we could spend 45 minutes to an hour at a scene, either trying to convince somebody to go, or treating them for something, or reversing their hypoglycemia, checking their blood pressure, blood sugar, doing a 12-lead EKG, and if they don't want to go, we can't compel them to go. But the only, the way the compensation model is built is to get somebody to go to the hospital, to transport them to a licensed, emergency room. But in some cases, when we're looking at healthcare and cost, and maybe some of the lower acuity ones that may be more efficient and cheaper for the system all told, if we're able to transport someplace else, like one of the community health centers or some other, to a non-acute setting, which would be less expensive to the system for them to deliver that, but we should still get compensated for our services there, because we have to be just as well trained and to do that, and maybe some cases more, and we still have to have the equipment to do that. But we're exploring those right now. We're also looking to improve our revenue enhancement, our collections with what we have right now. Well, what we've seen over the last few years is with all the changes in healthcare and the healthcare plans that are coming out, yes, there are more people that have coverage. There's less people who aren't insured, although there still are people who aren't insured. There are less, but it's a lot of the insurance out there right now has either very high deductibles, it is high copays, and a lot of them really don't want to, don't pay too well for services. So we're trying to maximize that in a couple of different ways, and we'll also be issuing a request for proposals to put our contractor who does our billing for us, to put that back out to bid this year, to secure a new contract to try to hopefully gain better performance in that field, because it's been evolving constantly over the years. Continue to promote diversity and professional development. Can't say it enough. It was there in 19. It was there in 18. It's always been I know it's important to this body, and it's always included in our budget documents how we're doing on that. And again, we just want to just reinvigorate that. Establish articulation agreement with local college, and we've done that with Bunker Hill, but we'll be looking to do that for other ones again too. Again, to improve the profession that our personnel are in. Advanced community preparedness. We want to do to increase our trainings out there. Besides CPR, there's a lot of interest in Stop the Bleed and other campaigns that are out there and available. We already have done some of that with some smaller groups. We've done it here back a few months ago. We trained on a Saturday. I think we came in and we trained about 60 plus of the officers from the municipal police who service this building, Court Street and other places, in We were in them with training for CPR, the AED, to make sure they're competent using the defibrillators. We did stop the bleed, which included the use of tourniquets and some special gauze to help slow down bleeding, so they'd be familiar with that. And we also did training for Narcan administration. We did that, and with AHOPE, who came in and provided instructors for that, to make sure that they were felt comfortable doing that. So, should the city want to start to begin doing that at public buildings. So we just want to keep doing more of that and advance community preparedness, because the community is, in many cases, our own first responders out there. And another priority for us this year initiatives is to address our Boston EMS station needs, our garage needs. So with my long rambling slideshow there, I'll...
Thanks, Jim. Thank
Stop.
you. And we've been joined by our colleagues from South Boston, Councilors Michael Flaherty and Ed Flynn, and we've just been joined by our Council President, Councilor Andrea Campbell. So, Jim, I'm going to start out by my annual information request of, the response times by neighborhood, by priority.
Yes.
First, and looking at the budget sheet, the increase for EMS is a little shy of 2%. We just appropriated the money for the most recent contract settled. Do you know where that percentage will end up? And I guess question 2 would be, does that just kind of level fund and keep the same amount of staff and units and everything basically the same?
Yeah, well, my understanding is that, yes, but it also, we should be taking into consideration the additional 4 FTEs we'll be adding this year, as well as I know that question was asked at the public health hearing last week about the that line item for the City of Boston supplement, and in subsequent communication with the budget office, it was explained to me that they had not plugged in that cost, even what you approved the other day for Ways and Means that you passed on and the council voted on, that because that had not taken place yet, it did not appear in the document, as well as what they would project it would be for the next, with step raises and stuff. So when they have that calculated, they told us that the actual numbers would be updated in that, but I haven't seen what those numbers are yet.
Right. Could we try to get that as well? Because I'm kind of troubled by the fact that if it's shy of 2%, I don't want us to lose the ground we've started to make up over these past few years. And looking at the information you forwarded on call volume, it seems like it kind of leveled off from the past couple of years, a little low, but we're still not hitting our goals for response times. And then when you look at the actual, where the call volumes come from, right? And where's that? Central Boston, and I think we did kind of a pilot program of some kind with like a triage around this area of Boston so that we wouldn't have to respond. Have you evaluated the success or maybe non-success of that program?
Yeah, well, some of that was was certainly involved in that Squad 80. That it's a non-transport unit. It's an SUV. It's staffed with two EMTs. The vehicle is fully outfitted with, they can do first responder. They can be the first on scene at a cardiac arrest. They can do everything that an ambulance can do, crew can do, except transport. But so they're able to provide first response, but they're also, again, they're able to help clear up by either relieving, or if the ambulance gets there first, or canceling an ambulance. If they get there first, if it's a situation where it's a little bit more complicated. I think some of the responses that we get, when I was giving you the numbers, like maybe say if it was 340 in a day, that may result in 320 transports. Now, that could jump, like that warm day last week, that jumped by a factor, add 50 to everything. But when we don't transport, it's, in some cases, it's a patient refusal, or in some cases, we just cancel. You get there, there's nothing showing. It was an MVA, you got there, and no, I'm fine, nobody's injured.
But that triage group would know, the goal was not to necessarily result in a transport, right?
Yeah, well, the initial goal
To
was...
tie up those units.
Yeah, initially it was like, not tie up an ambulance that we may need for another call somewhere, or a lower acute, because we do have to, given the number of units that we have on, we do prioritize the same way they triage. If somebody shows up at a hospital, some people go to a trauma room, some people go to a waiting room. And it's maybe not the best analogy, but we do triage the calls in order of priority, in order of acuity, using established guidelines up in dispatch. But when that unit goes out in the field there, yes, if there's, our dispatchers can use them if they think this call sounds like it maybe suspect of maybe not being a transport. There's some locations, I don't know, the units will get used to, like maybe certain ATM things in the winter where 5 times a day you go there for people are calling in because, well, there's a guy laid out.
Right.
And we're trying to find, well, is he breathing? I don't know. I'm afraid to go near him. So that becomes an unknown because we really,
All right.
we want to make sure.
I'll get back to that.
But it is helping in the sense that if you look at it, they were able to cancel and free up ambulances, just that one unit, over 1,000 times in less than a year. So it did demonstrate that there is value on that.
Okay.
And so again,
But we don't get reimbursed for that
No.
triage team,
No.
so that's a problem. But let me move on to one other thing before my time. Never mind. So I just want to, I'm going to just take one privilege here. The capital stuff with the 911 system. It seems to have been an ongoing project for like my entire time on the council. Can you tell me how EMS is involved with that new system? It's in I believe, the police budget for the 911, and I guess what I'm looking for is what's the status, what is the role that EMS plays in it, and who, if there is a contact, maybe from Do It or whoever is handling the project.
Okay. And Council, I know you said 911, but were you referring more to the radio, or were you referring more to the 911?
Well, both. I guess both.
Okay.
Yeah.
Sure. So, first to start off, on the 911, when the city switched, it was like a couple of years ago when they changed out the CAD system. They migrated from one platform, one vendor to a new one, and with the upgrades for the most part, yes, Capital took care of that. The police, because they host it at their building, they manage a lot of the aspects of it, but we do have representation on that as far as specific needs that we now have. We just did a major upgrade in the CAD. We got a few things changed, and every agency did. Police said, and fire. Everyone's kind of look at the tweaks that they would like to see out of it. And we have a deputy up in dispatch operations who's involved in that as well for us, representing our needs and desires up on that. And that is pretty much managed through what has been funded through Capital. We do get some costs associated with it, but so far, for the most part, on the CAD system part of 911, and for some of the costs that come in associated with the enhanced 911, some of that is paid for through the state PSAP, a Public Safety Answering Point grants. That's managed by the Boston Police. I know Superintendent John Daly is pretty much oversees that area.
John Daly?
Yeah, John Daly is the superintendent over there. And he's
At
been...
At BPD?
At BPD.
Okay.
Yeah.
John.
So as far as the 911 side, on the radio side of the house, yes, we are one of the agencies that similar police, fire, public works, schools, everyone, I've been told, has been, seeking some infrastructure upgrades. Principally, because all of our infrastructure was aging, a lot of the legacy systems will no longer be supported by the manufacturers, and the biggest one being Motorola in the coming years. There's been a change, just like all our televisions at home are all digital now versus analog, that's, I'm not a techie, so I can't even fathom.
So, and who is, last part, is who from EMS is at the table when this project is being implemented to make sure that, so I guess the final question is, the capital that is in BPD is for the system for police, fire, and EMS? Is that?
I believe it's in the BPD. I mean, they're in, I think they're getting ready to into year 5 of a 5-year, they call it their Blue Radio project, which is like approaching $50 million, which was a major redo of everything, soup to nuts, from the brains of the outfit of the system, which they call the core, up at dispatch operations, and right down to portables and radios in the field, and everything in between. The transmitter sites, receiver sites, the transmission lines to carry things back and forth. I know John Daly oversees that for the police department. There was not specifically money in that there for us contained in their budget, but fortunately for us, they've always have been very good about considering our needs, should we be able to jump on with expansion. And many of their sites, when they build capacity, they make sure there's enough excess capacity put in as far as cooling or rack space, power needs, which is done as they're building sites out, versus purchasing equipment for us. Has been on us, same as would be for fire or parks or schools or whoever else's radio needs. The funding for that has been through capital for them. Right now, my understanding is that there is, I think, $12 million that will become available July 1 of this year. And I think that's going to be in DeWitt's budget, because DeWitt was basically given the task of trying to entertain what the needs are for all the agencies. I know Fire's got some specific asks and requests. I know we've, at least 4 years now, we've turned in capital budget requests for radio infrastructure enhancements, replacements, to get on board with this new technology that's coming up to go digital, which will help us, because we did suffer a bit when we were forced to do narrow banding a few years ago. When the FCC required us to do it. It sort of, our coverage kind of dropped off with that. And we've been trying to do some stabilization right now to try to improve things. And before I digress in that, I'll stick to your original question. So with the last 2 years with the capital budget request, what was funded through capital was some money to do a study, a needs assessment, to hire a contractor to come in to evaluate all of the requests for all of these agencies, so that 15 departments don't come in with multi-million-dollar requests to see where can there be cost savings, where can there be efficiencies gained by co-locating or going together. And that's something we've always supported. That's something that we've written into every...
So that's the first phase, more or less, to study how to integrate.
But what we're trying to do is accelerate that and move it on, because there's some real opportunities and some real, I wouldn't say threats, but there's some downside if we don't move quicker. The BPD this year is installing their new core, and whatever core is. sounds important. I'm not a radio guy, but we currently operate off their UHF core up there. That's all our radios work through that, and which allows us to basically then whether it's police, fire, or us who's connected to it, our things could, like at some touch of some buttons by somebody else how to do it, transfer that to, you could listen to police, you could talk to the police, whatever. The idea is to have our communications be interoperable. Makes it very easy to do that. When they go to their new digital core, we would have to remain, because of our legacy equipment, we would have to stay on their UHF core up there, which will make listening and talking with them a few more steps involved to make that work. It wouldn't be as like switch on the fly available. So that's one thing. The other thing that is potentially troubling is that once they've invested their $50 million in their brand new system, they're not going to be wanting to spend dollars to maintain their legacy older system up there, which we'll be working on. That'll either fall to us and to maintain, which would be an added expense on our operation. So it would behoove us to be able to plug into their new system and get ready. In order to take advantage of that, at the very least, this year we would have to secure new dispatch consoles for us up in our dispatch operation, which is co-located with them. And so that's sort of a priority need for this year for that. And that has been addressed. We've been speaking with budget on that. I know that the BPD, one of their radio, I'll get his title wrong, Sean Romanowski, he's been working a lot to help facilitate that with us, as well as Superintendent Daley, and but capital budget office here has been pretty supportive of that as well. We recently, through an initiative and with a lot of hard work, with the support from BPD and Fire, and with our partners in the region, we're able to secure a commitment from UASI, which is a grant-funded program here that Boston hosts. The Mayor's Office of Emergency Management oversees that. We were able to secure funding to approximately like $1.3 million to replace that and update that equipment, that portion of there. That money won't become available till after January sometime, but the vote was there and the commitment was there, so that's good news. We'll be able to do that. Now, obviously, we'd have to take full advantage of it. We would have to do other work along the way. That's what we're hoping. One, the study will come in and give us the true cost. Okay. But we do believe that there would be some, and out of that $12 million that's sitting up available there, starting in July, like our goal is to have a actual plan for, not just say like, oh, good, well, give me 12. Yeah, we're like, no. This is what this is going to buy you this year. This is what's going to fix our needs, meet our goal our goal for year one. That hopefully we can have our transition complete in 2, maybe 3 years. 2 would be nicer, because the BPD are going into year 5. And there are efficiencies by able to, if we do work with them, about 70% of our sites were already co-located with them or close enough to them. We were recently able to start transmitting from the top of Bellevue Hill in West Roxbury, which has really helped a lot of us, and that's because the BPD had just rebuilt their site up there. Right. They put in extra space, extra cooling, extra power, a new generator that would support our equipment. So, again, they didn't procure that equipment for us. That was honest, but because we had that equipment, even though it's the older stuff, we're able to install it with their contractors. So there was some cost savings by able to jump on with them. The cost savings is in there too with their project management. Yes, you would have to buy more project management, but you're just adding it to theirs. Certainly less expensive than having to recreate the wheel ourselves.
Thank you, Jim. Councilor Asabi George.
Thank you, Chair, and thank you, Chief and Laura, for being here. I want to just ask a couple of follow-up questions, if you don't mind just sharing some of the data around the community assistance team, that squad, what are we calling it, Squad 80?
Squad 80, that's
Squad
their
80
call sign.
car. Do you have the number of sort of interactions that they've had? What sort of the typical assistance has been that's been rendered through that squad?
Yeah, do we have a more detailed breakdown? I know we get.
It works on about 46, I think, per week.
You can
Go ahead,
answer.
Laura.
That's fine, Laura. Thank you.
So when we looked at the numbers, it was about 46 interactions, and that would be the responses where they are added to a call. 46 interactions per week. They, I think the Chief Woolley said there's about 1,000 referrals, and those are principally to shelters and recovery services. I think it was around 700 referrals to shelters. As well, they do assist with providing blankets and other resources as they have available.
Is there any transport to any of our shelters through that squad car?
Yeah, I mean, for the most part, especially up at, they'll try to arrange for it with either the vans, the outreach vans there, but certainly if it's, really, really cold weather and stuff, they could do that. And we pretty much try to keep them available on scene and utilize some of the other ones, services that are out there. In a lot of cases, such as the engagement center, sometimes it's close enough to even just, or maybe we're at Mass and Albany, it's like we can walk them up to
Right, great, thank you.
A-Hope and just get in because they've got those connections now.
Great. Thank you. And then, is it, in the past with improperly discarded needles, EMS was who did the pickup, and now we have mobile shops, and we've got other people doing some of the outreach. That's really great. Is EMS still picking up needles from any sites, improperly discarded needles?
On occasions, we still get calls that come in from 311 to dispatch. Usually it's more off hours, and it really depends. We'll either send a supervisor or maybe a nearby unit to take a look. If it's, the priority then was like, somebody finds something in a playground, somebody finds something in a common hallway in a building with his kids and stuff. So we want to make sure we get rid of that. We may go up and look and say like, wow, there's like thousands that get discarded back behind it. That's clearly something else more for a team or somebody who's more equipped for that. But for some of the one-offs and stuff, yes, we'll get those. They'll go in as obviously a much lower priority call. But we do get some, but
And then how do you dispose of them if you're picking up that way?
all of our units have needle box. I have one in my car and stuff, and if I hear one go out, I'll just grab it on the way by. And
Are you able to track that? Because we are trying to get a better understanding of the amount of needles that we're collecting as a city. The most recent number I've heard as a city through various departments that we're collecting about 600,000 a year. Just wondering if your information is included in that, your data.
we could certainly do a quick look in our CAD search for that type of call. It's, again, it's more of an assistance. It's not it wouldn't go in as an EMS call, but we could look at that. That may not tell us whether we picked up one that was located near a slide in the playground versus three.
A handful, right.
Yeah,
right.
I'm not sure I can get.
If you can find it, that would be
But as far as the
that'd be
incidents,
helpful.
total incidents, we could get that for you.
Great, thank you very much. And then I really do love that you do the community service programs or the community outreach programs with the EMT course and all of that. The community CPR trainings, how many individuals do you train a year? I think Laura's got it. Laura, you can tell us.
Oh, yeah, you can talk.
Sorry, so last year, in calendar year 2018, we had about 3,300 CPR, individuals taught CPR, and that includes both the CPR certifications and the hands-only CPR.
That's great. And where are those happening? Those trainings, are they mostly happening at headquarters or are they in community spots?
No, in the community.
Great, so community centers, at schools.
Yep.
I'd love to get you into some of our Boston Public Schools to certify our students. Yes, they're happening there too.
That's throughout the community. A lot of them are based on community requests.
Okay.
And as well as businesses that might require certification.
Thank you. That's it for me. Thank you.
Thank you. Counsel
Thank you.
Flaherty.
Thank you, Mr. Chairman, and good to see the chief. It seems punitive. We've seen you 3 times. You've been in the well here for the last 2 weeks, so, but it's always good to see you, and an opportunity for us to commend you for the great work and your entire team of EMS does on behalf of the city. Can speak to that personally with time and attention that has been spent on caring for my family, but also for folks across the city. And I've often said that if it wasn't for EMS, that the death total for senseless violence in our city would be significantly higher, possibly even double. But for the fact that you guys are there in a very short period of time, and they're in one of the best trauma hospitals in the world. So that said, was curious to see, is there mandatory retirement for EMS? I know you fall under the BPPA, but and Boston Police have mandatory retirement at age 65. Do EMS have it? I know you're also efforts that I led here on the council to get your members Group 4, but I'm not recalling as to whether or not there was a mandatory trigger for retirement.
Yeah, no, that was not included in the Group 4 legislation that was passed to include this particular agency. Where I do see it in police and fire, just for one reason or another, it wasn't there.
Right.
But no, we don't.
And one of the issues that we're having, Chief, obviously with respect to the police, is that there's a large number of folks approaching age 65. So
Right.
one of the concerns I would have is, want to get a sense as to the sort of the state of the EMS workforce and how many will be retiring in the next year and how many will be retiring within the next 5 years. And that's important for us to know as a legislative branch to make sure that we're funding the appropriate number of recruits in classes for your workforce. So I don't know if off the top of your head, if you can surmise as to how many retirements you expect this year and say next year, as well as within 5 years. And based on what we're giving you, is that enough to keep up with the retention?
Top of my head, it'd be a little bit difficult, but it probably wouldn't take us too much to look at people who would be retirement eligible. So say, for example, if you're assuming that you want to go out at with the your calculated max, right? You have to be at least 55 at 32 years, right?
Yeah.
So we could look to see how many people would be eligible for that, and in any given year, this year, next year, and try to project that out. I mean, a lot of people do stay past 55. Some people go before that. A couple of retirees that we hit last year weren't quite there. They were like 2 or 3 years away, but they had other employment opportunities out there where they had some offers, and they, did the math on their own and figured like, well, yeah, I'll make a couple of percentage points less, but this other opportunity won't be there if I wait 3 years.
Right.
So some people do jump.
Okay.
Sometimes it's a career move.
Well, that'd be important, obviously, keep your eye on that with respect to Group 4, but also sort of the number of retirements that are being forecasted so that we can make sure we're giving appropriate attention to the resources for the backfill, if you will, or at least to keep up with retention.
No,
We also had the fire department in the other day, who also do great work on behalf of our city, talking about their response times, despite the fact that they're really solid. They are seeing between increased traffic and construction and the density that we're experiencing. I know that we had touched it last week when you were in, particularly as it pertains to the waterfront, or even like Dorchester Avenue as a parking lot for the most part, mostly during the day. Have you seen any issues with response time for EMS as a result of just the traffic woes that we experience as a city?
Well, I think traffic does play a part of it. I think responding to, unless you really hit something that's completely gridlocked or it's a tunnel closed or what have you, which is a real obstruction. For the most part, our personnel are pretty adept at emergency vehicle operation when it comes to lights and siren and trying to get your way through traffic or make a hole, and they're pretty good as far as even trying to they're very adept at finding alternate routes to get to places, because they learn quickly here or that. I think one of the things that perhaps we don't always consider is when you're now clear and trying to get back to your area, that the impact traffic plays on that, trying to get back. For example, if ambulance 7 clears the Mass General and it's, rush hour traffic trying to go back to East Boston, if you're not on a call, you're not going to activate your warning lights and fly in siren to go back. But so that it may take you a little bit to get back. The same way whether you're going back to Hyde Park or somewhere else, but you're traveling just like,
Right.
yeah, you going out
Right.
Back to a community meeting or something in Hyde Park that time of day, you have to
Right.
account for traffic. But yeah, it's probably a factor.
And then how many uniformed EMS personnel do we have on shift at sort of every hour of every day? Is there an optimum number that we have protecting our city morning, day, and night?
Yeah, as far as who's up and, I'll do the numbers real quick here, just about by two. So a typical day, 14. Okay, let me. So, assuming that we're at a base complement, like say on the day shift today with 21 BLS ambulances, that should be 42 EMTs, 5 ALS units on, so 10 medics, 2 or 3 supervisors, depending what's going on, plus a shift commander. We have a couple of special operations units on as well, too, on days. So back of the paper there, it's 52, 55, so maybe about just shy of 60 personnel. But now up in dispatch operations, we do an additional, on the day shift, there's probably like an additional 9 persons up there between supervisors, call takers, dispatchers, persons at CMed. So you could add that on there as well.
Right, and I assume with our population expanding that would move in an upward trajectory as you're calculating, the future as all the buildings, particularly down the waterfront, all the construction cranes that you see.
Oh, no, correct. When we get this recruit class through now, and with the other ones, we're trying to, really take advantage of the expansion that you and the mayor gave us last year with the 20. We'd be able to deploy another truck or 2 on days or evenings once we do get to that.
Great, excellent, Chief. Thank you for your time and attention, and again, your department does a phenomenal job for our city. It adds tremendous value, and we're just happy to have you guys. Thank you. Thank you, Mr. Chairman.
Thank you. Council Flynn.
Thank you, Council Ciamo, and thank you to Chief for being here, and more importantly, thank you for your excellent leadership that you've provided the city for so many years. Chief, I just wanted to follow up on a couple issues that Councilor Flaherty talked about. And I know we spoke about it recently, but the South Boston waterfront population continues to grow every year. We don't have a police presence down there or a fire presence or EMS. We did talk recently to the fire commissioner, and he was talking about that because of the population, because of the traffic, that he is experiencing a little more time for fire trucks to get into the seaport. I know you hit on it as well, but I think it's really critical for the residents of the South Boston waterfront to have a new EMS station there. And I know you are exploring different options, but I think it's really important to the residents. It's important to public safety. I think it's a critical issue as we see so many residents moving in there, but also we're seeing a large workforce in there as well. A lot of activity going on there, and a lot of public events as well. So I hope we can continue to work on what our short-term strategy would be, but also long-term strategy of eventually getting a EMS presence in the South Boston waterfront.
No, thank you, Council. And that's been a priority. That's been one of the priority asks for us going back 10 years ago. And, excuse me, we've had that in our request, so we put it on needs every year. You're correct, the capital budget a couple of years ago did include money for a study down there, and that study was completed. It looked at some of the needs, and it did make a couple of different recommendations. One was at this city Fine Day site, to either build where we could either have a standalone or shared facility with somebody on city-owned property. Another one was like, was there any ability to lease, or would there be any ability to get a linkage type program? We would be able to go in with another development going down there, whether it's another state agency or whether it's a private developer, where you could put in, again, whether, and they gave some examples in the document they did where some cities where they would have even a fire engine company in the corner of a building that's got a restaurant on one end and condominiums up top. I mean, I guess some cities do that. So that was one option they're looking at. Another option was exploring some of the city-owned parcels down there. I know the BPDA recently did make us aware that there's, I think it was 330 Dry Dock Ave. It's a small parcel, but it is owned by the city, and I don't think there's any thought for that being either sold to developers, but principally probably because it is small enough that it probably wasn't that desirable, and that dry dock's right behind it, so it's kind of, but, they did property construction in the assessment. It was something that could be used for at least a single bag station if it was done right. They did put that this July, 300,000 and change will be made available to do a study and design. I'm sorry, the study's done to do a design, which is an important next step, because in any kind of capital project, having a site having the study done to show the need is good. Having a site is really key. It's very difficult to find property anywhere. Well,
Right.
Boston's booming, right? The real estate wise, and but to find something that fits down in there that they could use and build on. So I'm encouraged that there is a site and there is money committed to actually do a design, because then things could flow after that. The station, the garage, the storage facility that was built out in Mattapan, out on River Street a couple of years ago, the fact that Public Health was able to identify a site on their existing property was a major hurdle, because they had looked around at abandoned or soon-to-be abandoned auto body shops anywhere and stuff in Dodge, trying to find a site that the city could maybe come in and grab. So when having that site helps a lot, because that really facilitated the design, and it saved some money on that. So that was like a three-phase project where within 3 years from inception to where we were actually able to move in. That one moved pretty quick by capital funding timelines. So I'm hoping that this is going to follow suit.
No, thank you, Chief, for your great work on this. Just as a point of reference, Brian Golden, the BPDA director, was here yesterday and testifying, and we were talking about the growing population in the South Boston waterfront. And Brian and some of the experts from the BPDA acknowledged that the population is going to grow double in the next 10 years down the Southie waterfront, and I said, that's really another reason why we desperately need an EMS station down there, a fire station. I love the building they built in the mid-'80s, the International Place building, where they had the firehouse and the EMS station together, and then they built the skyscraper above it. That motto seems to work.
Yeah, I mean, our ambulance one, paramedic one are currently located at 109 Purchase, which was a linkage project with Mayor. I think the guy's name was Flynn.
Yeah, I think I've heard of him, Chief. Yeah.
Okay. But, so we haven't forgotten that. Thank him.
Yeah. And Chief, I have one more question, if I may. I know how hard your employees work, and it can be a difficult job. It can be a stressful job. What type of, and I know a lot of this is done through the union, but what type of services are you able to provide your workers that are on the front lines, that are constantly dealing with difficult situations, trauma situations? Are we able to get them the right time off? Are we able to get them the right assistance for medical appointments or counseling or family time or any type of assistance that we can provide our frontline workers that are on the streets every night doing a very difficult job of saving lives, but I know it must be stressful for those men and women.
Oh, no, it certainly is, and, stress just, as, we all know is cumulative, the effects of it. It's, yeah, you can have a bad day or a bad night, but it's, if you have a series of them, or you never get over, or you don't get over one quick, you're carrying baggage around with you, whether it's something in your, personal lives, family lives, or on the job, it affects you, and that's, people across this city are certainly, afflicted with, invisible wounds that they carry around. As far as us at Boston EMS was, many years ago, it was the unions back when we were an ASME local, when we, the co-workers, our peers started building up a peer support team, a peer support unit, contracting, using our union funds and stuff to help secure services of professional clinicians to come in to help shape that, run debriefings, do some follow-up. Over the years, that grew, that expanded. The department now pays, significant funds every year to secure the services. We put out an RFP, and we contract with a provider now that gives us on-site here in like in the first floor of the building, Miranda Kramer here. There's hours down there where clinicians are available to meet with employees where they can make appointments directly with them. It doesn't go through us. I don't know who's going down there or who's getting followed up there or for whatever reason. That's certainly not. Just they track the contact hours, that's all, so they know that they're providing the services where employees can come in. And it's this is really no other office. We don't utilize any other space other than some storage on the first floor, so people's comings and goings there is pretty low key. But they can also make arrangements to meet sometimes off-site. We have they utilize licensed clinicians who are good for that. They have another facility which is off-site. Well, they call it the on-site, but it's really it's off-site. It's outside of Boston, and they also have the ability to send people to other places, even up in Brattleboro and Vermont or other ones. And it's we have a team leader for peer support who's currently a lieutenant, Pat Coulter, who coordinates those efforts, and he has a vehicle which he can also use. I mean, he serves as a lieutenant here, but which is good because he his ability to go on different shifts, and it's been kind of blend to the background. So if he's visiting or checking in with different people and stuff, if they're at work, it's not so obvious because it's not infrequent for any of us to run into a supervisor during the shift. So it's not like,
Right.
oh, here comes so-and-so, what are you seeing him for? So it's,
Right.
we try to, maintain that confidentiality and that low-key approach. But they do refer people out to meet with, again, like I said, the licensed clinicians. We have, and they do have the ability to pull people offline if they really think they need to, or even to go to take advantage of one of the programs that they have for peer support, for stress. And what's also good is that the agencies help each other out, the BPD, the fire, and sometimes if you they learn of a program that maybe the police or fire have, or something who may be good suited for somebody, they'll help make referrals and help each other get into places. Or I know we were talking before about, veterans, the home base program. Where we did a lot of training with them. They did a lot of training for us, for our people to recognize the invisible wounds of war and dealing with PTSD, but which was good for us. So it helps you see it in yourself as well, not your own patients, but your coworkers. But they were, without getting into it, obviously, and I don't even know who it was, but we had an employee whose spouse was a returning veteran, had some issues, and we were able to quickly facilitate getting that person there to help. That wasn't our employee, but that affects our employee's life, right? Because they need that help with their family with dealing with stressful situations. So that's a good thing to have about having partnerships and having our peer support people being able to talk to each other with confidence, because they're able to kind of help say like, hey, yeah, we saw this before. I know, I got just the idea what to do with that. So it's a lot of it goes on in the background. And again, I just pretty much just get some very gross numbers of contact hours, so we know that people are living up to deliverable. Part of it too is they have to do so many trainings for our teams, and they have to do a few other things we make sure that they do for what we pay them. And we have besides the dedicated lieutenant for it, he oversees a group of volunteer peer support people who also get release time to take trainings, so that they're a good chance they're already on shift. So there's almost every shift, there's already some people out there who have been trained to recognize and deal with some of these, and they can make the call to get somebody in, or go to the shift commander, or go to me, or go to one of the other superintendents and say like, hey, I think we got to get Ed offline, for a couple of days, and we'll do it, is our answer.
No, thank you, Chief, and thank you to your department and your team for great work in our city and our neighborhoods, and you're saving so many lives. So we want to say thank you to the men and women of your department.
Oh, thank you, and thank you for recognizing the need to take care of their emotional and other needs there too. Thank you for mentioning it.
Thank you, Chief.
Thank you, Councilor Flynn. Jim, at some point, maybe after the hearing, if you could provide the name of the gentleman you said, or gentlewoman, who is participating in the 911 and radio.
Sure. No, absolutely. I mean, like right now, I guess, from our side, for the radio thing, it's been myself pushing it. Obviously, I'm not the guy who runs the radios, but I'm the one that's trying to, coordinate activities with Do It and with Capital and with the police to make sure that we can make some progress, this fiscal year. I do feel very good. We're going to get at least a good bite out of it, and but we'd like to. But what we want to do is be able to offer, like, say, a plan to say, like, hey, this is the projected cost, but this is also the projected cost savings if we do it now.
Right.
But I will get you that.
Right, and obviously, hopefully, everything leads to better response time, so I look forward to seeing that information.
Yes.
I just wanted to ask a little bit about, and I know I probably should have brought this up during the BPHC, the Northampton Square project that, was supposed to provide space for BPHC, fitness center, I believe, storefronts. Does anybody have any update on that project? I think it's kind of in maybe phase 2, but I see in the capital budget that there's like $5.1 million for the Miranda Creamer Center, which I thought was supposed to be on Trinity's, was it Trinity? Trinity Financial, whoever the developer was supposed to renovate that entire building, and I'm just confused because that project was approved by the city council in 2013, now 2019, and I know that I think just the existing tower was renovated, and my understanding was the Miranda Creamer that has the South End Fitness Center was renovated, but wondering why we're putting money into the Miranda Creamer Center at all, I guess is the question.
Well, Well, I can answer some of that anyway. So the Miranda Kramer building is the building that we're currently in. So we have, our offices are on the fifth floor. We have office on the, we share space on the fourth floor, our training division, and with some other programs from public health, as well as on the sixth floor is where the medical intelligence center is. We have training. We have training sim labs and stuff up there as well. And we share some space up there with public health preparedness. So a lot of our operation is in there. On the third floor of Miranda Kramer is where our professional standards division is, where, and also our A&F, our administration and finance,
Yep.
all down there. Our IT support are down a location. And then I mentioned on the first floor, there's some space down there. We have some storage, but we also have our peer support offices are down there. So we're still very much active in that building. The second floor is public safety for the commission. Their public safety division is in there. So we utilize that building heavily. I thought some of the stuff that was in the budget for this year and the capital budget for that was to replace the roof on that building, as well as to replace the roof on the South End Fitness Center, which is, attached by a bridge with us that goes over there. We utilize some of the South End Fitness facilities for our recruit trainings at times, but for the most part, we're confined to Miranda Kramer. There was, I know, talk plans about either Trinity or BMC or somebody, acquiring the property, and, a lot of discussion about where we would eventually go. That seems to have been on the shelf, so I don't,
Right,
I
okay.
can't.
All right, and I think BPDA probably has more information on this at this point, at the stage of development, so I'll check in with them. I just want to make sure that what the council passed 6 years ago now, was favorable to Trinity, I thought at the time. But they made some commitments to the city, and in particular to BMC, but also BHPC. And I want to just make sure, even when I'm out the door, that they fulfill those commitments to the city residents. So just one last question on the EMS question. What is it? The affordable, it says affordable, one of your initiatives for city residents to go online to do a training. The online training or something? Where did I see that in your initiatives? It said affordable.
Oh, our EMT class, our EMT
Yes,
training being
I'm sorry.
affordable.
Yeah.
And I guess, depending what your budget is, affordable is always a relative term.
Affordable is different.
But for, our current, our cost went up this year to provide training as an EMT. I think it's $850 to take our class. Most places, like if you go to Bunker Hill Community College, if you go to Mesa, a lot of the other places, it's at least double that.
Right.
It's clearly that. Our goal was always to make it affordable to cover our expenses, basic expenses. We have a training captain who's the lead instructor up there, but we also, the training assistants pretty much just get a stipend, which is just a flat rate for helping out at the class to try to keep it more affordable. And so it's less of a barrier for people to get their EMT certification if they come through our class.
Well, and with the new diversity officer.
Yes.
And the funding that comes with City Academy.
Yes.
I think that's a place that person should focus on too, getting folks from the neighborhood, from the city of Boston, through the Neighborhood Jobs Trust, because that's where that funding actually comes from, for City Academy, I believe. And that money comes from all of the development you see in the city of Boston. So we should be taking those resources and making sure City of Boston residents. And just lastly, what is the entry-level EMT employee coming on the street? What is their starting salary?
Oh, you had asked me that.
Current-
Recruit or EMT, once they stop? once they-
EMT, graduated, you know,
Yeah, about 57.
57.
Yeah.
Okay, all right.
Yeah,
Not
yeah, the recruit, when they're in the recruit, they're one grade below that.
Gotcha.
And then they go up at, but then 57 plus, their, hazard duty or other stipends that'll
Right.
be coming in.
Well, thanks. And, as I finish, this is actually the last Ways and Means hearing for this season before we have resubmittal and such. But I'm glad we ended with EMS, the men and women, the team behind you, your folks, the supports in the gallery here. Again, make us very proud. I think you heard it from all of my colleagues. We're very proud of EMS, the work you men and women do. All of our public safety officials, I think we are the model for the world, quite frankly, the way we approach public safety, the results we get. So I just want to thank you. Again, happy EMS week, and this hearing is adjourned.
Thank you, Council.